If you're a man over 40 or you love someone who is, chances are you've already heard conversations about the prostate. Maybe it started with waking up once at night to urinate, then twice. Maybe the stream doesn't feel as strong as it used to. Maybe there's that hesitation, that pause where you stand there waiting for things to start. And somewhere in the back of your mind, a quiet question forms. Is this just aging or is something going wrong? Here's what most people don't realize. Prostate enlargement is incredibly common, but it's not something that simply happens without influence. There are biological forces at work. There are risk factors we can modify, and there are also limits to what we can control. The key is understanding the difference. The prostate is a small walnut-shaped gland that sits just below the bladder and wraps around the urethra, the tube that carries urine out of the body. When you're younger, it plays a role in fertility. As you age, it often grows. This growth is called benign prostatic hyperplasia, or BPH. Benign means not cancer. Hyperplasia means an increase in the number of cells. It's not a tumor, it's not an infection, it's a gradual thickening of prostate tissue over time. During adolescence and early adulthood, prostate growth is heavily influenced by male hormones called androgens, especially testosterone. Inside the prostate, testosterone is converted into a stronger hormone called dihydrotestosterone, or DHT. DHT binds tightly to receptors in prostate cells and stimulates growth. Without androgens, the prostate simply doesn't develop normally. But here's the interesting part. As men age, testosterone levels slowly decline, yet the prostate often continues to enlarge. So hormones are part of the story, but not the whole story. If declining testosterone were the only factor, prostate enlargement would slow down dramatically with age. It doesn't. So what else is happening? At its core, BPH is about imbalance. In healthy tissue, cells grow and cells die in a controlled rhythm. In the aging prostate, more cells are being produced than are being cleared away. Growth factors increase. Inflammatory signals increase. The tissue thickens. Over time, this enlarged tissue compresses the urethra and alters how urine flows. Genetics plays a role. If your father had significant prostate enlargement at a relatively young age, especially requiring surgery before 60, your risk may be higher. That doesn't mean it's guaranteed, but it means we pay closer attention. Inflammation also appears to be important. And when we talk about inflammation, I don't mean something dramatic. I mean subtle chronic cellular signaling inside the prostate that promotes growth. This inflammation can be influenced by infections, immune activity, metabolic changes, and even alterations in the prostate's microscopic environment. Over time, inflammation can create a cycle where growth feeds more inflammation and inflammation promotes further growth. Then there's metabolic health. This is where prevention becomes more realistic. Conditions like diabetes, obesity, high blood pressure, and abnormal cholesterol tend to cluster together. We call this metabolic syndrome. Men with metabolic syndrome are significantly more likely to develop symptomatic prostate enlargement. Higher body mass index correlates with increased prostate volume. Larger waist circumference correlates with a higher risk of urinary symptoms. Elevated blood sugar levels appear to stimulate growth pathways in the prostate. I've seen this pattern in my clinic for years. A man comes in with bothersome urinary symptoms. We talk about his prostate. We talk about his blood pressure medication, his blood sugar, his weight gain over the past decade. These systems are connected, so one of the most powerful things you can do to reduce your risk of developing bothersome prostate enlargement is protect your metabolic health. That means maintaining a healthy weight, monitoring blood sugar, staying physically active, managing blood pressure. These steps don't guarantee you'll never develop BPH, but they meaningfully lower the likelihood that it will become severe. Let's talk about physical activity specifically. Even moderate exercise makes a difference. Regular walking, cycling, swimming, and resistance training, these improve insulin sensitivity, reduce inflammation, and support hormonal balance. Men who engage in consistent physical activity have lower rates of symptomatic BPH. And we're not talking about extreme athletic training. Even brisk walking a few hours per week shows measurable benefit. If you're thinking, I haven't exercised consistently in years, that's okay, start where you are. The prostate responds to long-term patterns, not one perfect week. Now let's address diet, because this is where confusion often sets in. There is no single miracle food that prevents prostate enlargement. Anyone who promises that is oversimplifying a complex biological process. But dietary patterns do matter. Diets high in saturated fat and frequent red meat consumption are associated with increased risk of prostate enlargement and urinary symptoms. Diets rich in vegetables, fruits, whole grains, legumes, and healthy fats appear protective. A Mediterranean-style eating pattern emphasizing plant-based foods, fish, olive oil, and moderate portions consistently correlates with better metabolic and urologic outcomes. Lycopene, a powerful antioxidant found primarily in tomatoes, has been studied extensively. Some data suggest that men who consume adequate lycopene may have a modestly lower risk of developing BPH. Cooked tomato products may even enhance lycopene absorption, but again, this is supportive, not definitive. I encourage patients to think in terms of overall dietary quality rather than single nutrients. It's also important to recognize that certain foods can irritate the bladder even if they don't directly enlarge the prostate. Tomato-based products, caffeine, alcohol, and spicy foods can worsen urinary urgency or frequency in some men. That doesn't mean they cause BPH. It means they can amplify symptoms if enlargement is already present. Medications matter too. Some over-the-counter cold medicines contain decongestants that tighten smooth muscle around the prostate and bladder neck, making urination more difficult. Certain antihistamines and older antidepressants can reduce bladder contractility. If you already have urinary symptoms, these medications may worsen them. Always review new medications with your physician, especially if you've noticed changes in urinary flow. Now, here's an important question. Can you completely prevent prostate enlargement? The honest answer is no. Aging itself is a risk factor. Most men will experience some degree of prostate growth over time. The goal isn't to eliminate growth. The goal is to reduce the likelihood of significant symptoms, complications, or unnecessary procedures. And that brings us to something many men worry about but rarely say out loud. How do I know if what I'm experiencing is normal aging or something more serious? If you're finding this helpful so far, take a moment to like the video and subscribe to Urology for You. It helps us reach more men who may be silently struggling with these same questions. And I'd love to know in the comments, what urinary changes, if any, have you noticed as you've gotten older? Your experiences often help others feel less alone. So how do you know when prostate enlargement actually needs attention? Many men assume that if the prostate grows, surgery is inevitable. That's not true. In fact, most men with BPH never require surgery. The decision to treat is based on symptoms and quality of life, not just prostate size. Some men have significantly enlarged prostates and barely notice them. Others have moderate enlargement and feel very bothered. Symptoms can include a weak stream, straining, hesitancy, a feeling of incomplete emptying, frequent urination, urgency, and waking up multiple times at night. Occasionally, men develop urinary retention where they are unable to urinate at all. That situation does require urgent evaluation. When symptoms are mild and not disruptive, monitoring is often appropriate. We call this watchful waiting. That means regular check-ins, symptom assessment, and lifestyle optimization. No medications unless symptoms progress. Many men remain stable for years. When symptoms begin interfering with sleep, work, travel, or daily comfort, medication becomes a reasonable option. The first class of medications we often use is alpha blockers. These relax the smooth muscle in the prostate and bladder neck, improving urine flow. They work relatively quickly and are generally well tolerated. They do not shrink the prostate, they improve function. The second category includes medications that reduce DHT levels, thereby gradually shrinking the prostate over time. These are typically used in men with larger prostates. They take longer to show benefit, but can reduce the risk of urinary retention and surgery in selected patients. Each medication has potential side effects. Alpha blockers may cause dizziness or low blood pressure in some men. Hormonal medications can affect libido or ejaculation. These risks are usually manageable, but they should always be discussed openly. Then there are minimally invasive procedures. Advances in urology have provided options that are less invasive than traditional surgery. Some use heat, steam, or mechanical implants to reduce obstruction. Others remove tissue directly. The right choice depends on prostate size, anatomy, symptom severity, sexual priorities, and overall health. Here's something important. Bigger is not always worse. I've treated men with very large prostates who function quite well, and I've treated men with modest enlargement who are significantly bothered. Treatment decisions are individualized. Another common misconception is that BPH automatically increases prostate cancer risk. They are separate conditions. Both become more common with age, but one does not directly cause the other. Prostate cancer screening decisions should be made separately based on age, risk factors, family history, and shared decision-making. The long-term outlook for BPH is generally very good. With appropriate monitoring and timely intervention when needed, most men maintain an excellent quality of life. Serious complications like kidney damage are uncommon when symptoms are addressed appropriately. So, what questions should you ask your doctor? Ask how severe your symptoms are and how they are being measured. Ask whether your prostate size suggests medication would help. Ask about side effects and how they might affect your daily life. Ask what signs would indicate the treatment should change. Ask about follow-up intervals. And perhaps most importantly, ask what you can do personally to improve your outcome that keeps you engaged in your care rather than feeling passive. Prostate health is not about fear, it's about awareness. It's about understanding that aging is natural, but suffering unnecessarily is not. If you're early in this journey, focus on metabolic health, physical activity, balanced nutrition, and regular checkups. If you're already experiencing symptoms, know that you have options. Thoughtful, individualized options. I always remind my patients that we are partners in decision M. There is rarely only one correct path. There is a path that aligns with your values, your tolerance for risk, your comfort with medication, and your goals for quality of life. If this conversation has helped clarify things for you, consider sharing it with someone who might benefit. These are discussions many families avoid, yet so many men quietly endure. And I'd like to hear from you. What concerns you most about prostate enlargement, medication side effects, surgery, cancer risk, or simply not knowing what's normal? Leave your thoughts in the comments. I read them, and they help guide future episodes of Urology for you. As always, take care of your body thoughtfully. Pay attention to changes. Seek guidance when something feels off. And remember, good medicine is not about reacting in panic. It's about understanding clearly and acting wisely. You deserve that clarity, and I'll see you in the next conversation.